Hi friend, myself Dr. Surjit Ghosh. Welcome to my channel Dr. Ghosh Presents. Today the discussion will be on how to detect black fungus early and prevent it. What is black fungus? Black fungus is a rare but very dangerous fungal disease whose mortality rate is about 50%. Medical name of the disease is mucormycosis. This fungus is available freely in the environment, for example, in soil, fields, decayed fruits, soiled veggies, rotten breads, etc. That is, this fungus is rare, means it is rare to attack a person. Mind it, black fungus is the name of the fungus and the disease also called black fungus. So here, this is a dangerous fungal disease when it attacks somebody, but it attacks very rarely because there are some situations when black fungus attacks others. That will be discussed very soon. Who are predisposed to black fungus? Number 1, diabetics. Number 2, those having very low immune power. Number 3, those who have been treated with steroid non-judiciously. Number 4, those who received oxygen through non-properly sterile tube or humidifiers. 5, those who have been treated with multiple complex diseases. Number 6, that is most important, convalescent COVID-19 patients. Actually, to follow this convalescent patient, this black fungus was caught. During the treatment of this COVID-19 patient, it has come to surface. So that is most important. On the right hand side, this is the microscopic picture, a high resolution picture of black fungus, and this is the low resolution picture. Both are microscopic. It is low resolution, it is high resolution, black fungus. What are the symptoms of black fungus? Number 1, pain deep in the eyes, blurring of vision, double vision, swelling on one side of the face. See, look, swelling on one side of the face. This is swelling on one side of the face. This is deep, pain deep in the eyes, nasal block, sinusitis. This is a sinusitis, X-ray of sinuses. So sinusitis is black portion is sinusitis. Necrosis of the bridge of the nose. That particular picture is not here. The bridge of the nose is necrosed, that is completely destroyed, and the color becomes black. That portion is to be cut out, and it needs to be operated through plastic surgery. There's replacement of skin. Bleeding or black discharge from nose. Bleeding or black discharge from nose. Persistent headache, loss of sensation locally in the face, looseness or tooth. Suddenly, a person who has no problem with tooth, she feels that his tooth is loosened or there is severe toothache. Chest pain, breathing trouble, fever, frequent change of mood, and finally death. How much has black fungus spread in India? Till today, 24/5/2021, that is the day before the publication of this date, black fungus, BB means black fungus. BB spreads over 16 states. Most of the states have decided it as an epidemic. There are named 15 states here. The West Bengal name is missing here, but West Bengal has already added to the split. As of now in India, about 9,000 patients have been suffering from this fatal disease. How much fatal fungus is? Can it bring death? To start with, the symptoms of the BB appears very name, that is very simple. But once infected, this spread aggressively to the vital parts of the body like brain, lung, causing termination of the life catastrophically. Why suddenly is the black fungus so rampant? The think tanks of medical science have pointed out that the following mishappenings in treatment of COVID-19 patient are the reasons for sudden rise. Mainly Dr. R. Panda of Asian Heart Institute, Bombay, Managing Director, and AIMS Director, Dr. R. Gularia, they have talked a lot about it, about this thing. Now, I have collected the main 2 points from their orations. Number 1, unhygienic way of administering oxygen to patients. particularly non-sterile state of tube supply oxygen to patients, and non-sterile state of water in the humidifier. And number 2, indiscriminate use of steroids, immunosuppressive drug, to control COVID-19. Is black fungus contagious? No, it is not contagious as COVID-19. Nevertheless, it is infective. It can infect. That infection it causes personally as a solely, but it doesn't carry from contact. Infection caused by BV which are abundantly available in the environment. Infection happens only when the host system has a very low immunity. This is the most important. This is the most important thing we must understand, that every system, that is our body, has got some immune power. When this immune power is very, very low A, then this commensal or opportunist agent, fungus, there are so many opportunists, this opportunist agent comes in the surface and attacks the host. Otherwise, they remain silent. How does black fungus spread? BB is freely available in the environment around, but these are not aggressive. They are of commensal type. However, when the host is very weak, they enter in the system of the host and multiply quickly to cause serious damage. How to prevent black fungus? Diabetic must keep sugar under control without compromising their immune systems. Use steroid very judiciously. Hygienic practices must be followed. That is, these hygienic practices. The hygienic practice we are used to now due to COVID-19 disease. That hygienic practice must be followed because this will control the entry of this particular fungus in the system. So, though it is not infective, though it is not contagious, but this hygienic practice will help. While putting patient on oxygen, ensure strictly sterile condition of tubings and humidifiers. Number 5, preserve the immune power of the system. The body's, our own body's immune system must be preserved. Otherwise, if it is get very much feeble, then they will attack. When to consult a doctor? This is the most important part of this video. This is the most important. When you come across any of the following symptoms, please consult physician instantly. Because once BB starts action, it proceeds faster than COVID-19 and brings about destruction much faster. This particular disease, the practicing doctors came across during treatment of COVID-19, but they found it that it attacks faster. It moves very fast. The symptoms are deep pain in the eyes, blurring of vision, double vision, swelling of one side of the face, nose block, sinusitis, bleeding, black secretion from nose, persistent headache, loss of sense in part of the face, sudden looseness of tooth or toothache, change of mood instantly. These are the symptoms. The symptoms have been described here. It is already stated just one time before. With this, we are concluding this video. Please accept my thanks for listening and viewing. We will be meeting once again later on.